Now, you might be surprised to know that one of the recent methods being used to detect COVID-19 in different parts of the Maritimes is to go into sewage systems and get some samples of wastewater. It's a project that was launched jointly last year by Dalhousie University and the Fredericton company Lumin-Ultra. They started out by doing some testing in Dalhousie and also at the Acadia campus in Wolfville, but now they're expanding to include universities and airports around the province, and Richmond Municipal Council might be on board as the scene shifts to the sewage systems for municipalities and towns. Here's what the discussion on that issue looked like last week at Richmond County's regular council meeting. Take a peek.
Following our December 7th Committee of the Whole meeting, staff was asked to investigate the benefits, feasibility, and potential costs related to the experimental research that was happening in the research project for sewage testing for COVID-19 that had been recently announced in the news. It was related to a project of Dalhousie University. They partnered with a private company to test the wastewater in Halifax and Wolfville for the presence of the virus. The virus was detected in the wastewater in Wolfville. So following that meeting, staff did provide some additional background information, including that the findings of the research project will eventually be shared with the Nova Scotia Health Authority and that the project may be expanded. Staff also contacted Lumin-Ultra Technologies, the private company that's patented the rapid on-site testing, wastewater testing solution, and they advised that the cost of the testing equipment was approximately $20,000 and the cost of each test kit for the equipment was approximately $30. The company stated that there were presently, at that time would have been mid-December, there were no labs offering commercial testing of wastewater for COVID-19. The staff recommendation in December was that the municipality follow the guidance of Nova Scotia's Chief Medical Officer as it relates to the possible future testing of wastewater. However, recently, the news of the predicted expansion was announced and reported. Researchers will be making regular sample collections from the Halifax Airport, as well as Dalhousie, Acadia University, St. FX, and Cape Breton University, and several additional towns and municipalities. So I wanted to bring this back to Council, given this new development, for just general discussion and the potential to reach out to CBU or DAL regarding a potential partnership.
So I think what you're basically wondering is whether or not we should put our name forward as being a municipality that would be interested in this expanding pilot project. Mm-hmm. We're not talking about spending $20,000 to do right. And I thought that was kind of the understanding that we had the first time we discussed it. So I would say I would definitely like to see us sending a letter to the folks who are running those projects to just say we would be interested in participating or finding out more about the expansion perhaps of that project, for sure, okay. Especially if it's a no-cost or a very low-cost event.
I would support that project or put our name behind it for sure. I mean, for us here in Richmond, I mean, we've been lucky and you know, like it says in the study, you're not going to be able to track any particular cases, but any kind of spike in wastewater testing would kind of indicate a community spread, right? So right. I would support that project for sure. Yeah.
To see the news that that kind of research was landing so locally at CBU and St. FX was very exciting, and the staff had done a really great job of providing us with an update of where the project was prior to the new year. Now things have evolved, that research is expanding. I think this is a great opportunity for us to sort of put our hands up and say, as a Cape Breton municipality, we're interested in learning more, in potentially being a part of this. I mean, there's obviously we'll need to watch cost implications, but we do have sewage systems here that could potentially be a part of such a study. So it's a great opportunity to put our hands up and say, you know, we're interested in participating. I think it would be a really strong move towards public health and safety as well. So.
Any specific discussion with the Public Works Department about that?
Not yet. As you heard at the meeting this evening, we had a really great update from them prior to Christmas, but now there's new developments, so looking forward to what they come back with.